When did it become a crime to become sick in the United States of America?
For the hard working man, these jobs is gone. Computers is taking up all our jobs and everything, and so you just have to hustle and scuffle the best you can. Don't give up, but just have to do what you can. But the money that you make is just barely enough to pay your lights and water and gas bill, and you don't have nothing for your medical.
And I came up here, and I remember the first time I met Eve, and I went out of here with a big bag full of my needs, and I was crying because I knew without that medicine I would die.
This was just like a dream come true. I mean,
yes.
More than you could even dream of.
And so, I'm here tonight. This is, my house had an appointment tonight, but I'm here tonight. I tried to give back a little bit and help Eve out. And the people that work at the clinic, I help them out, just try to do what I can. I can't do very much, but I can sit on a chair for an hour and help. I just kind of like a little assistant. I do what I'm told.
Lost my job first, lost my house next, lost my wife and kids.
Well, you're a hero too, that you don't give up.
How can you give up? You have to go one day at a time. Well, actually, my doctor quit seeing me because I didn't have the money to pay him. So he told me I would have to find another doctor.
And when did this happen? After July 13th?
After I lost my job.
It's a nightmare.
It is. Yeah. I thank God for these people. If it wasn't for them.
We have your Actos Plus Met, one a day for your diabetes. It's just one of those a day.
They look rather large.
Well, it's a bigger thing than the pills actually are.
Oh,
And you can break them in half if you need to. And we've got your lisinopryl's half a one, once a day.
Okay.
And your triamterene is half, once a day. And your Zocor is half, once a day. And while I have you here, especially now that you're on the Actos Plus Med, you probably have filled one of these forms out before. But if you could fill that out for me now, and I will pull, I'm doing the indigent drug program where we can send to different companies and get free medicines of things that we can't even afford to give to them. So they fill this out for me with their information. I get their information from their chart. And then these are some of the application forms that I've been trying to go through and
all
decipher.
these?
Well, some are for some drugs, for some they're different drug companies.
The topic is a community health forum on health care. The title is Why Not Here? And you saw a clip from the mayor of San Francisco. That city has started a program to provide health care for every single citizen, regardless of income level, regardless of pre-existing condition. And I think that's very admirable. And you saw the mayor, Gavin Newsom, say it's a moral obligation, and we hope that this idea will spark the imagination of people elsewhere. That is one of the inspiration for this show. Another was my own health, which I had open heart bypass surgery 3 years ago. I was very fortunate to have health insurance through my wife's employer. However, she had just started and we didn't even know if it was going to pay, and it just added tremendously to the stress. And I don't think any American should have to go through things like that. So I'm going to introduce the panel because some of a brief time, and I really appreciate their being here. But Eve Bratton is the founder, one of the founders of the Ask Medical Clinic. You just saw 3 people that I interviewed, brief clips from those interviews. And so, yes. Yeah. Pardon?
We have some staff members here from the mayor.
Okay. Well, we want everybody to have a chance to talk, and so that's why I'm keeping my remarks brief. Tom Henry well, with us for about a half hour. Really appreciate it. He's running for mayor. I know he has a lot of things to do, but thank you. And Tom Hayhurst, Dr. Hayhurst, is a member of our city council. Very interested in this topic.
And I'm going to interrupt everybody. Give Eve Bratton one more hand because
Yeah.
she did start. She did start the Matthew 25 clinic 30 years ago, and the Ask clinic, and she really dedicates herself to that work.
And is an amazing hospice nurse.
Yeah, there you go.
Yes, she's a hero.
Fort Wayne's
That's-
answer to Mother Teresa.
Yeah, absolutely.
Absolutely.
Well put. Absolutely.
It is an honor to be here with Eve, for each and every one of us.
This show is just an excuse to honor Eve Bratton.
Yeah.
Okay. Well deserved. Thank you. And Karen, as I was saying, is running for city council, 2nd District, which is a district I live in. I wish her all the luck. And she was formerly the economic director of the city of Fort Wayne. And Dr. John Walker is MD here in Fort Wayne. He's a member of the user for Common Sense Health Plan. And we'll hear more about that. Edith Kenneth is a therapist at Park Center and a leader of this locally of this plan. And in our audience is Gloria from Fort Wayne Reader, who has just passed her truck driving test and didn't think she could be here, and she is, so we're delighted. And I'm trying to get a lot of different viewpoints. And Sonia, who you just saw on the TV, is here from the Ask Clinic, and you could see her appreciation. So I'm going to start with Eve to talk about Ask and why this is such an important topic. Yes.
Okay. I talk soft, and I don't know. Do you want me up there, maybe? Or I could sit. Anyway. If you can't hear me, just let me know. Anyway, I want to say thank you to Terry for letting me to speak about something that I care about so passionately. I have been in the community nursing, community healthcare for over 30 years. And I've worked with the poor and the underinsured for many years trying to obtain health care. A few weeks ago, I saw a video, the viewing of Michael Moore's Sicko, and it was very difficult to watch for me. I had to pinch myself from weeping because of the cases he presented. I see thousands and thousands over the year. Many times those of us who work in the healthcare and work with the poor, work in social services, you kind of shield yourself from all the things that you feel and you see and you hear. Otherwise, you couldn't work. And going to Michael Moore's film was sort of like PTSD for me, post-traumatic stress syndrome. It was very difficult. When I began working in the community, it was much easier. It was like putting puzzles together. People would come to me, they'd have a health need or something. I would call a doctor and say, Dr. Joe, can you see this person? He said, oh yeah, send them up to my office. There was more social service agencies in place. And so I was kind of like the gate through and able to put these people where they might get help. Then I and other social workers and other agency people were invited to come to Bearfield, or what's it called now, Fort Wayne International Airport, for a conference with Dan Quayle and Dan Coates, who explained the new Ronald Reagan's trickle-down theory. And from then, the safety net of social services began to unwind, and federal support for many agencies was cut. It wasn't soon after that that I began to see not just the generational poor, but the working poor and the new poor. Many were very bewildered because they weren't used to knowing how to play the system of how to get care and going through the maze of the social services. Those generations of poor who had been in the system, they knew what kind of questions they needed to ask. They had kind of an underground network to set people up. I was at a meeting about 15 years ago when Dr. Nancy Snyderman came to Fort Wayne, and she spoke about managed care, which had not yet arrived to our fair city. She said just like rollerblades, managed care would be coming, and so it did. And the healthcare dollar did not flow down. It went into the pockets of the CEOs, and those CEOs made millions, and she was right. A bright spot shone briefly when I was in Indianapolis after that at a social service meeting in which the Clinton health care plan was unveiled. It was a glorious feeling. It was exciting. Everyone was quite happy because there was hope for individuals now to get help. I and other people worked very hard, but we were up against a lot of obstacles, AMA, insurance companies, and drug companies. And they had a very large campaign that ensured that the bill was defeated. So here we are now. There's no trickle-down principle. The money flows up. The CEOs of insurance and managed care are making tens of millions of dollars a year, and people are suffering. The last 2 years have been the hardest for us. We've been working in the community. There are fewer resources, less funding, that people are sicker. And I don't know any family at all that is not touched by this. They don't have somebody in their family with insurance. It is more difficult for me to do what I do. I can no longer call physicians up and say, hey, can you come take care of this person, because now there's 3-4 layers of phone calls before you get to the physicians, because we have managed care now. Doctors who are willing to help in the specialties are now in with groups of people, and it's not to their best interest to have one physician seeing a lot of poor people or people without pay. We, the people, are supposedly, in the United States, the richest people in the country, in the world, the richest, the most powerful nation, yet we are 40th with life expectancy. And it's not just our obesity, it's not all our chronic illnesses. A recent diabetic study showed that diabetes is increasing around the world. We are the only developed country that doesn't have basic health insurance for its people. Every day I see evidence of our healthcare system failing. Yesterday I met an 84-year-old man who has just heard that he is losing his healthcare benefits from his retirement company. Jonathan Kosal, who writes in his book, Rachel and Her Children, on the homeless, it's an older book, and he always said there's 2 tragedies before you become homeless. Now I think it only takes one major healthcare crisis. It doesn't matter if you're poor, it doesn't matter if you're middle class, it doesn't matter if you're rich. If you are too ill to work, you're going to lose your insurance, you're going to lose the ability to pay your rent or keep up your mortgage, or you're going to have a lien against your house because the health care bills are so high, and you're going to lose your house to become homeless. The healthcare system is failing. It's always failed the poor, but now it's failing all segments of society. The money doesn't trickle down. It trickles into the pockets of HMO, the insurance companies. The CEOs can only make that kind of money by denying care to people who are sick. It's unethical and it's immoral. Each time someone comes into a clinic, either Ask Matthew 25 Neighborhood Health Clinic, it's a failure of our system. Each time someone dies at home because he or she does not have the thousands it took for them to go to the emergency room and did not seek care, as my friend did this year, it's a failure of the system. Each time I have to argue with an ill patient to take an ambulance to the hospital because I believe they're having a heart attack, it's a failure of the system. Each time I prescribe a test for a person and the tests are not done because they don't have the money to afford them and the system says they can't get them, it's a failure of the system. When a woman is walking around with a uterus the size of a 7-month pregnant woman and I can't get help for her, it's a failure of the system. Afraid of socialized medicine, Medicare is socialized medicine. And I can't wait till the people that I see get to the point where they can get on Medicare. The healthcare system is too lucrative for those with money to want to change it, and we are the people to have to rise to that challenge. It is a moral thing to do. As Christ said, we are our brother's keepers. And the old saying, WWJD, now what will we do? Thank you.
Tom, do you want to?
I just have a few words to say. First of all, I have the honor and the privilege of serving on the board of directors of the Neighborhood Health Clinic. I have for several years now, where we serve many uninsured and underinsured individuals. That number is increasing. It's increasing daily. Not only that, but because we are a very open community, a lot of the immigrants coming into our country are coming to this area. They are coming to Fort Wayne. they have needs. They don't have insurance. They don't have access to basic health care. So we have a number of challenges that we're going to be facing in the months and years to come. Let me share with you just a few thoughts in that area. I also had the pleasure of working in the healthcare arena. That's how I first met Heath and several people up here on the panel years ago. It came to my attention that much of what we are experiencing today as far as the dilemmas in healthcare could be solved, or certainly could be significantly helped, if we were to address a few basic areas of healthcare. And I would work very hard as mayor with the healthcare community if they were willing to step up and address these needs in some type of single-payer program. And I'm sure my good friend Dr. Hayhurst will get into that in a minute. But one of those areas is simply prenatal care. By insufficient prenatal care, we are exposing newborns to a broad array of problems that will cost us ultimately millions of dollars in the months and years to come, because these young women did not have access to good prenatal care. To me, that should be something that we should be giving our young people access to, or those who are pregnant. Secondly, immunizations. We already have a program in Fort Wayne. It's a wonderful program, Super Shot Saturdays and so on. We need to continue that and expand it. Make sure every child in our community is immunized. We have the responsibility to them. And finally, I believe that every single one of us has the right to an annual physical, because by early detection of things like prostate cancer and other types of cancers, we can address those needs early on and prevent possible death. So those three basic areas I think we could address as a community and would not be that expensive. We can do that. We have a right to that as citizens of Fort Wayne. So I want to thank you for the few minutes I have today with you. Unfortunately, I do have to leave in a little while, but I'm sure, again, my friend and colleague, Dr. Hayhurst, will take over and do a much better job than I. Thank you.
Tom and I sat across the city council table for a few years, and we were Tom H. and Tom H. And people were usually able to keep it sorted out, and I was honored.
He's much better looking than I am.
Honored to serve with this young gentleman over here, Tim Henry, over the years. I went to medical school a few years back, basically in the 60s, and at that time, I've seen statistics since then, something like 80% of all physicians stated they went to medical school because they wanted to try to deliver health care and make the world a better place, so to speak, to provide needed health care wherever it might be. And from that time, I've been a firm believer that health care, good, solid health care, is a right for every American, every citizen of this planet, and I still definitely believe that. There's no question that our health care, what used to be somewhat of a health care system, is deteriorated, it's broken, it's essentially a non-system at this point. We really have no viable healthcare system in place at all at this particular time. And especially last year when I was involved in any particular endeavor, in the last couple of years, I did a lot of research, and there's, I'd say, no question. The General Accounting Office says that 18,000 Americans die every year because they do not have affordable health care. 18,000 Americans die because they don't have access to health care. We just had a conversation off to the side before tonight's gathering started, and someone said, well, can't everyone just go to the ER and get care if they're sick? Well, theoretically they can, but here's what happens. I was a pulmonary critical care doc, and I still am, in this community, and I didn't retire, I just got rewired. and over the years, I've seen many cases where individuals with a respiratory illness, whatever it might be, intestinal problems, who does not have health insurance, puts off going and seeking health care, toughs it out, like the individual Tom was talking about that hasn't had any prostate screening and then begins to develop symptoms of that type, holds off as long as possible, goes to an emergency room in a crisis situation, the mortality rate or complication rate in that situation goes way up. And I have taken care of those individuals in the last days of their life, literally, on a ventilator. I know I have seen some of those 18,000 people die every year because they don't have affordable health care. That's part of the problem. The other part of the problem is if you go to the ER and you have no health insurance in the United States of America, get ready to mortgage your house, because if you spend a couple hours in the ER or a couple days or 2 weeks in the hospital, you know, the hospital, whether it's public or private-based system, they are very likely going to come after you and insist that you pay your $40,000 or $50,000 hospital bill, and you may well mortgage your house and be out on the street, and the cycle we heard earlier that's hit so many individuals will continue. I just read a great paper that was forwarded to me by Edith Kenna, and that was and she'll clue you in on this and tell you where you can get this paper. It's about a 10 or 15 page review of healthcare needs in the LA County area by a Los Angeles County Council of Churches. Christians, Jews, Hindus, Muslims, Buddhists, various community leaders, all on this particular organization. They talk a lot about Judeo-Christian principles being the foundation of our society. Certainly they're written into the Constitution of the United States. As far as I'm concerned, when it comes to, and I'll say this to anybody who tells me they're a believer, and we're talking about 90% of the American population, let's apply Judeo-Christian principles to this situation. Let's develop some type of system that will provide affordable health care for all Americans. It's totally contrary to the principles of Jesus Christ and among the Christians or any religious leaders for individuals. For us to have 18,000 deaths in the United States every year because of lack of affordable health care. There are a lot of ways to get there. You're going to hear a lot of different ideas today. We need to get there, and we need to move there steadily and make that happen. Thank you.
How do you see economic development playing a part?
Well, I think that healthcare and economic development relate to each other sort of back and forth at a number of different levels. Certainly, from just a straight getting businesses to expand in a community, the cost of healthcare is part of the metric that they use. And so if we live in a community where healthcare is very expensive, then that's just one more cost that becomes a reason why businesses wouldn't necessarily invest. Sort of on the other end of that is that in a city like Fort Wayne that has so many regional medical facilities, that the healthcare industry itself becomes something of an economic development factor. I would just wanted to say a couple things following three really hard acts to follow. But the thing that really kind of concerns me about the healthcare discussion in this country is that it is, I think it's been hijacked or dominated by arguments that to me don't make any sense. But yet we all sort of cede those arguments. The system, we couldn't have the government